The World Health Organization is sounding the alarm on diabetes. One of the largest studies ever conducted on the disease was released this week. It says the number of adults worldwide with the condition has nearly quadrupled over 35 years. 11 million Canadians are living with diabetes and pre-diabetes. Officials say the rise is putting a huge pressure on healthcare systems. Dr. Joelene Huber is here for more on this. She's a pediatrician and professor of medicine at the University of Toronto. These statistics are alarming. What is behind this massive rise in diabetes?
Yes, well, as you mentioned, this is one of the largest studies we have to date looking at these trends globally. And the researchers are saying that there's two main reasons for this. One reason is that around the world we are having a growing aging population. And we know that type 2 diabetes is more common in the aging population and in adulthood. But also a big contributor is obesity. And so obesity has become a worldwide, almost an epidemic. And it's not just in the high resource countries, it's in the middle income countries, and even in some of the low income countries, we're seeing this big rise in obesity. And the obesity is because we're not eating healthy around the world globally. We're becoming less active, and that's contributing to this rise in obesity and then the rise in type 2 diabetes.
And so how does this affect Canada's healthcare system? We're hearing that it's putting a strain on healthcare systems around the world, right?
Right. So the Canadian Diabetes Association estimates that about 11 million Canadians are living with diabetes. Primarily, that's about 90% of that is type 2 diabetes. And so there's 11 million that have diabetes or pre-diabetes syndrome. So they're on their way to getting diabetes. And a lot of the times what happens in type 2 diabetes is that our bodies are resistant to insulin, which helps our body use that sugar. So you have high blood sugar, and that leads to things like damage to the blood vessels and the nerves. And so it's really this strain is coming from the complications from type 2 diabetes. So things like stroke, heart disease, diabetes-related blindness, kidney failure, there's nerve damage and foot problems, so a high number of amputations are coming from diabetes, erectile dysfunction in men. So all of these are these complications that then contribute to our healthcare system having this burden, and a burden that people are carrying. There's one estimate that said about in 2014, there was about $8 billion US dollars worth of costs, probably due to diabetes-related healthcare issues. So, I think 30% of stroke, 40% of heart disease, 50% of kidney failure and being on dialysis, and 70% of amputations in Canada are attributed to people living with diabetes, type 2 diabetes.
It's unbelievable. My mother is part of this category. She takes pills for diabetes, and we got her on the bicycle last summer. We're going to keep that up because diabetes is prominent in the South Asian communities as well, all around the world. So what can people do individually to prevent diabetes?
Right. So the basics are really, really simple in terms of just eating better and exercising more. So it's simply said, but hard to do. So, but really we need to sit down, meet with your healthcare provider, your doctor, your nurse practitioner, whoever it is, and find what your ideal body weight is. So it's different. We all have different heights and different body types. But if you can reach and maintain your body weight, talk about healthy eating, so cutting back the fats in our diet, healthy portions and healthy calories, and becoming more active, that can help to really prevent the onset of diabetes, help to control your diabetes, and help to maybe that you won't get diabetes.
And what about governments? What can they do? I mean, we talk about sugar levels, the content, labeling. Is that effective?
Yeah, so all of these things, the World Health Organization with their report that just came out said this really needs to be a societal approach, and a government at every level needs to get involved. We need to have health awareness, education starting in childhood, so that how we eat and how active we are in childhood often carries, those patterns carry out into adulthood. Health policy and regulations on the food industry. If food industry becomes involved, like you said, with labeling, with making healthy food more accessible. I mean, this year we saw a huge rise in prices of produce and vegetables, and it's just not accessible to some people. And often fast food and junk food is more accessible. Schools need to be becoming involved. Workplace encouraging fitness and healthy eating. So it really is, it begins in the home, and it also begins with society and government. We need to take this as a wake-up call and really become more active and eat better, and so we can prevent this problem.
Yeah, it's an important conversation. Thank you so much for coming in.
Thanks for having me.
Dr. Joelene Huber, a pediatrician and professor of medicine at the University of Toronto, joining us here in studio.